We reserve a few minutes to discuss current trends that you'd expect from reading Bible prophecy. We are futurists. That means we interpret all unfulfilled prophetic passages as future events that will occur in a literal, physical, apocalyptic, and global context. Biometrics, artificial intelligence, cashless commerce, the manipulation of human DNA, global government, the exponential growth of human knowledge, and the rebirth of Israel as a nation are some of the trends we see that corroborate the end times prophecies of the Bible. Most of our recent talks have involved the global pandemic because that's what's on the table right now. COVID-19 is not the fulfillment of any particular prophecy. However, the methods and the mandates that are being utilized globally to combat it are predictive of the future socioeconomic system that will play a major role in the government of the Antichrist. See if I'm talking about the tribulation or right now. Citizens will be mandated to participate in a system by which they must produce proof of compliance in order to be allowed to work or shop or dine or attend entertainment. Without that proof, their livelihood and lifestyles will be restricted. That could apply to the Great Tribulation. That's what's going to happen under the Antichrist. But it also is what is happening now in terms of the goings-on. California state legislators getting ready to debate whether or not they're going to institute vaccine passports for us to be able to go to public places if we're not vaccinated. Now that we're into the pandemic's second year, we're starting to get data on the unforeseen consequences of the methods and mandates governments are using, and I want to talk about that a little bit this week. All of the following, until I tell you otherwise, are quotes from reputable sources, not my embellishments or my opinion. These are all right out of the news, and again, not conspiracy sites, places like the CDC and the United Nations, which I guess could be a conspiracy, but you know what I mean. Anyway, listen up. Nearly 1 million people in England became addicted to alcohol as a result of COVID lockdowns, official data suggests. Dr. Tony Rao, a world-renowned expert on alcohol misuse in older people at King's College London, warned the impact of lockdowns had been devastating. Deaths directly caused by alcohol soared 20% during the first year of the COVID pandemic. More than 87,000 Americans died of drug overdoses over the 12-month period that ended in September, according to preliminary federal data, eclipsing the toll from any year since the opioid epidemic began in the 1990s. The surge represents an increasingly urgent public health crisis, one that has drawn less attention and fewer resources while the nation has battled the coronavirus pandemic. The United Nations entity, UN Women, said domestic violence reports in France have increased 30% since they initiated a March 17 lockdown. Domestic violence calls in Argentina have increased 25%. The organization also reports a 30% increase in helpline calls in Cyprus and a 33% increase in Singapore. Terry Poor, policy director of the National Alliance to End Sexual Violence, says close to 40% of the rape crisis centers surveyed had seen a increased demand for services since the outbreak. A World Health Organization report on global child abuse noted that schools were closed to 1.5 billion children worldwide because of the pandemic. Their parents faced heightened stress and heightened anxiety from lost income and social isolation, potential crowding in the home. Additionally, more time online may expose children to an increased risk of online sexual exploitation or bullying. Henrietta Fore, director of UNICEF, said in a statement about the report, lockdowns, school closures, and movement restrictions have left far too many children stuck with their abusers without the safe space that school would normally offer. It is urgent to scale up efforts to protect children during these times and beyond. A new study by McKinsey & Company not only showed huge learning losses among American children due to the pandemic, but also shocking estimates of the long-term economic impacts these learning losses would have on the United States. New data on learning loss and student mental health issues is incredibly disturbing. Children have been damaged academically, mentally, and economically far more than COVID has hurt them. Overall, 41% of respondents surveyed reported at least one adverse mental or behavioral health condition, including symptoms of anxiety disorder or depressive disorder, symptoms of trauma and stressor-related disorder related to the pandemic, and having started to or increased substance use to cope with stress or emotions related to COVID-19. The percentage of respondents who reportedly have seriously considered suicide in 30 days before completing the survey was significantly higher among respondents aged 18 to 24 years, minority groups, self-reported unpaid caregivers for adults, and essential workers. An August 2020 edition of the New England Journal of Medicine reported uncertain prognoses, looming severe shortages of resources for testing and treatment and for protecting responders and healthcare providers from infection, imposition of unfamiliar public health measures that infringe on personal freedoms, large and growing financial losses, and conflicting messages from authorities are among the major stressors that undoubtedly will contribute to widespread emotional distress and increased risk for psychiatric illness associated with COVID-19. Across the United States, there were 25% more murders recorded in 2020 than the previous year. Homicides in California jumped 31% last year, making it the deadliest year since 2007 as the nation's most populous state struggled with the COVID-19 pandemic. Emergency room visits for adolescent suicide attempts soared this past summer and winter, especially among girls, perhaps in connection to America's struggle with COVID-19, CDC data revealed. A report by Wellbeing Trust found that 75,000 additional people could die from what they call deaths of despair, which include suicide and substance abuse because of COVID-19. A Yale Professional Journal article concluded excess mortality during the 4 months of the study was more than 2 times greater than the number of COVID-19 deaths confirmed by PCR testing. Countermeasures against COVID-19 should be chosen carefully in light of suicide effect. The Journal of American Medical Association Psychiatry Journal concluded the combination of physical distancing, economic stress, barriers to mental health treatment, and pervasive national anxiety are creating a perfect storm for suicide mortality. Don't be depressed. Actually, I mean that. Because these studies and articles are talking about people we know who are without hope, and they need Jesus. Remember that when they want to shutter the church later on this year or coming into next year, because I'm sure that's coming. Here's something I came up with. People need more than life. They need eternal life. So the things we're reading here, people need more than life. And this thing is going to be going on for a long time. The pandemic could stop tomorrow. It's not going to, but it could. And we have long-term effects on people's lives and families and all. It's not, believe me, hey, I know that COVID is real. We've known people who've died from it. We've known people who've almost died from it. We know people in the hospital right now from it. So that's not the point. What I'm saying is that the methods that we're choosing to fight it are going to have lifetime effects on people. Terrible, I can't think of the D word, terrible effects. And so we have that hope, right? The gospel in earthen vessels. And so we're not excited about these things, but we're cognizant of them because we believe the Lord is coming back, and we want to tell people that there is hope in Jesus Christ. We believe the resurrection and rapture of the church is imminent. It could happen at any moment. After reading that, you're hoping it would happen right now, I'm sure. Nothing needs to happen before it happens, and it will happen before the Great Tribulation. Are you ready for the rapture? If not, get ready, stay ready, keep looking up. Ready or not, Jesus is coming.